Quick note: this is an automated educational summary of public medical sources, Mayo Clinic, the NIH, and MedlinePlus. It is for tracking your health markers, not medical advice. Always confirm results with a licensed clinician. According to the NIH, vitamin A deficiency affects millions of people worldwide, yet most don't know they have it. Here's the thing: it's one of the few micronutrient gaps that medical research can actually measure with a simple blood test. But the cost confusion, the ordering process, and what the numbers mean, that's where most people get stuck. In this video, we're breaking down exactly what Mayo Clinic and the Cleveland Clinic say you need to know about testing for vitamin A deficiency in 2026, including real pricing, how the test actually works, and how to order it online right now. Mayo Clinic lists night blindness, trouble seeing in low light, as one of the earliest warning signs. You might also experience dry eyes, rough or patchy skin, and frequent infections. Now, these symptoms show up for lots of reasons, but if you've noticed a pattern alongside dietary gaps, it's worth testing. The Cleveland Clinic notes that severe deficiency is rare in developed countries, but marginal deficiency is more common than people think. If you're on restrictive diets, have malabsorption issues, or don't eat much liver or orange vegetables, testing makes sense. Here's who the NIH and MedlinePlus recommend for testing: people with digestive disorders like Crohn's or celiac disease, which mess with nutrient absorption; anyone on fat-restricted diets; people with cystic fibrosis or liver disease; and those experiencing unexplained eye or skin symptoms. You don't need a specific reason to test. Direct-to-consumer labs let you order without your doctor. But if you're on medications that affect fat absorption or vitamin storage, flagging that when you order helps interpret your results accurately. The standard test measures serum retinol. That's the active form of vitamin A circulating in your blood. MedlinePlus lists the typical normal range as 20 to 50 micrograms per deciliter, though labs may vary slightly. Below 20 is considered deficient, and above 50 is excess. Some labs also measure beta-carotene, which your body converts to vitamin A. Mayo Clinic explains that retinol testing is more direct and accurate for actual vitamin A status. A simple blood draw, usually under 5 minutes. No fasting required for most labs, though it's worth confirming when you order. There are two main options when you order online. The serum retinol test is the gold standard. It directly measures vitamin A in your blood and costs between $40 and $120, depending on the lab. The second option is a beta-carotene test, which is often cheaper, around $30 to $80, but it's less accurate because conversion to vitamin A varies person to person. Most direct-to-consumer labs offer just the retinol test, which is fine for most people. Some micronutrient panels bundle vitamin A with other fat-soluble vitamins like D, E, and K, which runs $150 to $300 but gives you the whole picture. Let's talk money. A standalone serum retinol test through LabCorp or Quest without insurance usually runs $45 to $110. If you have insurance, lab work might be covered under preventive care or diagnostic testing, but you'd need a doctor's order. That's where direct-to-consumer labs come in. No insurance, no doctor needed. Micronutrient panel bundles are $150 to $350, depending on how many vitamins you add. Some telemedicine platforms pair the test with a consultation for $80 to $200 total. Telehealth options can actually be cheaper than ordering the test alone, since the doctor's interpretation is included. The easiest route is direct-to-consumer labs. You go to labcorpondemand.com or questhealth.com, search for vitamin A or micronutrient tests, add to cart, check out, and get a lab requisition. You'll take that form to your nearest collection center. There are thousands nationwide. The whole process takes 5 minutes online and 10 minutes in the lab. Another option? Telemedicine platforms like Everlywell or Let's Get Checked. They mail you a fingerstick kit. You collect it home, mail it back, and get results, plus a clinician's interpretation. Shipping adds a few days, but it's completely at home. Both routes work. It depends if you prefer the lab or home collection. Online lab results usually arrive in 3 to 5 business days. Your result will show your retinol level and where it falls against the reference range. If you're in the normal range, that 20 to 50 mark, you're good. Below 20 means it's worth discussing with a doctor to figure out why and whether supplementation or dietary changes make sense. Above 50 isn't an emergency, but excess vitamin A is fat-soluble and stores in your liver, so that's also worth a conversation. MedlinePlus and the Cleveland Clinic both recommend talking to a healthcare provider before starting any supplement to rule out underlying absorption issues. Here's what matters. Vitamin A deficiency is testable, affordable, and easy to order online without a doctor. Costs run $45 to $120 for a standalone test, $150 to $300 for micronutrient panels. You can order through LabCorp, Quest, or telemedicine platforms in minutes. Results come back in 3 to 5 days. And remember, Mayo Clinic and the NIH agree that if you suspect a deficiency, this test gives you actual data to talk through with a healthcare provider. It's not a diagnosis tool. It's a starting point for a real conversation. If you found this useful, the link to get started is in the description below. What type of health tests are you interested in? Comment below and we will make a video about it.